Hello people, in this video let us look at this book Piyush Gupta Clinical Methods in Pediatrics. Let's look inside. Images, tables, pretty colorful book. Contents, people, history taking, growth assessment, anthropometry. How will you examine each system? The main thing you should understand in pediatrics, right, what is very important is a weight of the child. So weight of the child is very important, and also the temperature, because children can go into febrile seizure. So the first thing you should do is fever management, tepid sponging, give paracetamol, etc. Okay, so that is an emergency, I'm telling you. However, any case that you are given, first thing you will note is the temperature and the weight of the child. So, clinical approach to common cases. Which are the common cases you will get in exam? You will get a case of fever, you will get a case of loose stools, diarrhea, edema. Edema can mean a cardiac issue or a nephrotic syndrome, nephritic syndrome, etc. Pallor, that's anemia. You can also get protein energy malnutrition. Congenital heart disease like VSD, etc. Rheumatic fever also you can get. Seizures usually will be febrile seizures, etc. And it can be a case of epilepsy, etc. Hemiplegia, hemiplegia or a cerebral palsy kind of a thing. Okay, those are common cases that you will get. You will also always get one newborn case, so you should know all the newborn reflexes, etc. How to check newborn, you should know. You should know how to plot growth chart, people, for boy, girl. This is the height, this is the weight, everything you should know how to plot. And then only you will know it is within the normal or it is, what do you say, large for gestational age, small for gestational age, etc. Now let's take a sample case. There's a child with fever given to you. So what and all you should know. So basically, like we told you, whenever there's a child with fever, if the fever is the first thing, then you'll have to do tepid sponging and make sure that the baby is not having fever, so that you can prevent febrile seizures. So you will ask, then you'll go to history, short duration, prolonged duration, etc. Then you have to rule out why the things are happening. Fever, is it with rash, etc. Is it with cough? So just fever itself, they've written so much in this book. With burning micturition, see, that will indicate you a UTI. Okay. So what will fever with jaundice tell you? Go here to this table. It can be hepatitis. Okay. So that is why they are talking about it. Malaria, it can be, if it is jaundice, because there is rupture of RBCs, hemolysis. Okay. Dengue also, which can lead to bilirubin accumulation leading to jaundice, isn't it? Cholangitis, leptospirosis, etc. So just a case of fever is going in so many directions, isn't it? So if there are rashes, chickenpox, measles, dengue, chikungunya, rubella, erythema infectiosum, typhoid, Kawasaki disease, drug rash. Then some other things that you may see, hepatosplenomegaly, arthritis with the fever. What does that indicate to you? Rheumatic fever, that thing comes first to me, isn't it? What if the fever is associated with loose stools? So on and so forth, guys. So this book is not the exact format I would recommend, not the book I would recommend for you for pediatrics, because I think case wise, if it was there, it would have been better, because you will get a cerebral palsy case, or which, you know, MBBS works that way, where they tell you the case, kind of a hint is given to you, isn't it? So this book is kind of nice, not so exam oriented, I feel, especially for case discussion. This book is better for examination, in the sense examination of the child, you know, How do you examine what is this? Examination of general physical examination. Examination of this cardiovascular system. How do you examine? Examination of the abdomen, just abdomen of a child. How will you examine? Examination of nervous system. So that ways this book is good, how to examine the child. But exam oriented cases are not there and not elaborated much in this. That's what I feel. That's all for now, guys. Make your decision. Bye bye.